Okay, so this is for the preceptorship presentation for Nursing 493. So for my overview of my preceptorship experience, I'll be honest, I remember when we first got our little sheets that gave us our assignment, I wasn't the most thrilled about the unit that I got, which was med-surg, because my heart is just really with kids and babies, and I really was praying for the labor and delivery unit, because that's where I want to go after graduation. I want to be on labor and delivery. But I remember when I got it, and I was disappointed. But I remember I just spent some time praying about it, and I was like, I can't change this, and it'll be fine. And I was like, Lord, I don't know what you have planned for me, and only you know, and I'm sure it will be great. Prepare my heart for these patients that I'll encounter on the med-surg unit, and I'm just trusting you. I know it'll be good. So I remember that, and then when, like my first day, when I met, I'll go back. I tried to go in with a really positive attitude and not expect the worst, which is normally what I do. So I just tried to be positive about it, and I was like, I'm just going to take this day as it comes and just make it great, since I'm going to be here for a while or so, I thought, before Corona came along. So my preceptor, her name is Jennifer, and she and I got along really well, like right off the bat, and I was really happy about that, because normally when it comes to being like even paired with a nurse in clinical, or even like instructors, like anyone like that, I do better when they're encouraging and nice, but also firm with like what I need to do, because my first ever clinical experience, fall semester junior year, it was not good, and like it was just hard for me to learn well because it was just distracting. And so I was really happy with Jennifer, and that was also an answer to prayer. So she was very encouraging. She was a phenomenal preceptor. I couldn't have asked for anyone better than her. She was really easy to like work with and talk to and ask questions, and she was always willing to teach me any second that there was, and so that was really helpful, and I appreciated that a lot. So I didn't dread working with my preceptor at all, so I was really thankful for that. So other than like feeling comfortable with her and like getting used to the unit and all the patients and like taking care of people and like getting used to what the real nursing world will be like, I think in all of my clinical experiences I've been I'm like hesitant, like where I've just felt not competent in things or not confident in general, and I really wanted that to be different. That's why I also tried to keep a positive attitude so that I wouldn't bring myself down. And thankfully, with Jennifer being so encouraging and helpful, it helped me gain confidence, because I knew that she wasn't like judging me if I did something wrong. Like, she would step in to help if I did, but I never felt like, I don't know, like I was gonna get yelled at. I don't know. But I feel like in nursing school I've learned that I'm kind of scared of failure in a way. Like I just don't want to do anything wrong, and I want to get everything right. And so I think that makes me come off as not confident in skills, even though I know how to do them, what they are. It's just, I think that being scared of not doing them perfectly gets in the way of that. So I kind of learned that, and I wanted to put that behind me in preceptorship. So I think overall, like throughout the entire experience, I just learned a lot about myself. Even though I was only able to go 4 times, those 4 times were still just beneficial to me in lots of ways, and I think I just gained confidence and just learned a lot from Jennifer, like through techniques and like ways to chart more efficiently, and just things like that. So I think overall that would be like my overview. So for 2 patients, I remember, well, I didn't have any like really significant things that stood out to me, but I'm remembering 2 patients that I can talk about. So one of the patients was a 52-year-old female. I had her my last time at like my last day I was doing preceptorship. She had been in a really bad car accident 20 years ago, and so she's been in and out of hospitals ever since because she had a traumatic brain injury resulting from that. She was kind of easily aroused, very drowsy, slurred speech, couldn't really swallow, incredibly confused. She was admitted for altered mental status, a UTI, and hypernatremia. And then she had a medical history on top of that of bipolar disorder and seizures and the traumatic brain injury. She was also being monitored for depression as well, so there was just a lot going on, and it was just kind of sad every time we went in the room, and she couldn't talk. She just would kind of grunt, and I don't think she was in any pain, but resulting from the traumatic brain injury, she had severe contractures on both of her upper extremities, like her hands, her arms, like she couldn't move, and if we tried to move, then she would kind of grunt, so we knew that that's when she would be in pain. She was stable for the most part, but I remember Jennifer and I had to go in there to give her an IV, and it was so hard because we couldn't really move her arm to get the IV in. It was just very difficult. It took we were in the room for a long time trying to get this IV in her, so, but we got it, and it was all good. And then she had a Foley catheter that was inserted, and she had an intact urine culture, which came back testing positive for ESBL, E. coli. So she was on contact precautions, but it was secured through the catheter, so it wasn't out for everyone to get. And then she was on a falls risk. But I remember that, and I just remember, I don't know, I just felt really bad for her, and it was just hard to, I mean, we did all that we could do, but it was just kind of sad. And I had never seen contractors before, so that was interesting to see. And then my second patient, I actually talked about him for my project for our other class, our capstone class. But I had never seen a patient with a hospital-acquired infection, and I think this was also on the last day, or the second to last day. He was a 68-year-old male. So he was originally admitted to Athens Piedmont Regional for a COPD exacerbation, but while he was there, he acquired pneumonia while at that hospital. And then Athens Piedmont Regional discharged him with steroids and oral antibiotics. And then he was at home for like 5 days, and then it got worse. And then he was admitted to St. Mary's. And then while he was at St. Mary's, he was on vancomycin and Marum, and then he developed shortness of breath, a wet productive cough with green sputum, hypoxia, and then he also tested positive for flu. So he was on the Vanc and Marum for the pneumonia, and then Tamiflu for the flu. And he had been there for a couple of days at St. Mary's. We had given him a CT of the chest, and he had pneumonia in the left lower lung field, and then he was being treated with an incentive spirometer. And by the time that I saw him, he had already been there for a couple days, and he was getting better. I mean, he still had the cough and oxygen, but he was getting better. But I just thought it was interesting because I had never seen a hospital-acquired infection before, so I thought that was interesting to learn about and just see how all that is taken care of. But he was getting better, and I think he was going to get discharged within 1 or 2 days. So those are 2 patients that I guess you could say stuck out to me that I remember. the most, but yeah, overall, even though I only got to go 4 times, preceptorship was a good experience, and I enjoyed going. I do know that when I am working as a nurse that I want the night shift. I am not good with waking up early in the day. I'm most awake at night, so I think that's another thing I learned. I'll probably go for night shift. So overall, it was a good experience, and I'm glad that I got that unit and I got to work with Jennifer. So the Lord did cool work there.